morning, everybody. My name is Juan Ramirez. I'm from SalaUno in Mexico City, and I would like to share with you this wonderful organization from which I feel very proud to be part of. I hope you enjoy it. Some of you may be thinking that there is something wrong with the projector, but actually it isn't. We are all looking through the eyes of a person with needed blindness. And I want to ask you, could you imagine living like this? Do you imagine your everyday life activities like this? Well, 2 million Mexicans, they do. In Mexico, blindness is the second cause of disability, and 50% of the cases are due to cataract, and cataract can be cured with a safe procedure. There are different causes for cataract, but it's mainly associated with age and diabetes. And in Mexico, our population is starting to get older, and we also have the second highest rate of people with diabetes in the world. With these reasons, we are expecting that every year there will be 300,000 new cases of cataract, from which 165 will go untreated, mainly because of economical barriers, but also because they don't have access to quality services. This is a huge problem in Mexico, so we need a solution. And in SalaUno, we want to be part of this solution. So we will eradicate avoidable blindness in Mexico. And to know that we are successful on this goal, we will be measuring the number of eyes with sight restored. But how we're going to do it? SalaUno is based on the successful model of the Arabic eye care system in India. And based on these ideas and principles, we will offer high-quality eye care services for the bottom two-thirds of Mexico's pyramid. And what is going to differentiate SalaUno from other hospitals is that for SalaUno, the most important thing is the patient. So we have a patient-oriented culture. And also, we are affordable, because the prices of our services are 1/3 of other hospitals. Now, let's take a look on our competitors. In SalaUno, we are not alone. We have 3 important competitors, and they have different prices for different target markets. In SalaUno, our price ranges will be affordable for 85% of the market. This means that we will be good enough to serve the upper part of the pyramid and use those margins and revenues to serve the bottom and the middle part of the pyramid. But this is not, we need more differences than our competitors, and these are our competitive advantages, which are mainly driven by cost and service. Efficiency is very related with cost, and in SalaUno we want to use our resources the best possible way. That's why our doctors, they have the highest rate of surgeries per day than any other hospital in Mexico. We also are using high-quality, low-cost material for our surgeries, and we are introducing a new cataract surgery technique with excellent outcomes for the patient, and also with a lower cost than the traditional practice. And like this, we will continue using other techniques and technology for our surgeries. About the services, we do outreach camps. Every weekend, we take a team of doctors and optometrists to villages and communities surrounding Mexico City to reach for the patients. In some other hospitals, people can wait for 270 days to receive their cataract surgery. In SalaUno, they only have to wait 2 to 5 days. And like I said, the most important element is the patient, and we will treat our patients with respect, dignity, and compassion. But delivering these kind of services can only be made by our human resources. So we are focused on training our staff. And for that reason, we have created the first school training program for ophthalmology nurses in Mexico. Now, let me explain you how all these ideas are going to come together. The patients can have access to our services through 3 different points: base clinic, vision centers, and our weekly outreach camps. In each one of these, the patients are screened and they receive their diagnosis. Some of them will require eyeglasses or medicine that can be purchased on our drugstores and optic shops in each facility. Others will be referred to other specialty hospitals, but 25% of them will be diagnosed with cataract. It is very important to help the patient to make the transition from diagnosis to treatment. So in SalaUno, we want to motivate our patients to comply treatment. And to know that we are being effective on this strategy, we are going to measure the conversion rate. how many patients, after the diagnosis, they decide to undergo for treatment. Once the patient has made the decision, he has two options to pay for the surgery. It can be from their own money, but also it can be reimbursed or subsidized by a third party. This means that the surgery will be free for the patient, and a third party like the government insurance or our social ally Cinepolis will pay for his surgery. After the surgery is performed, then the patient returns to SalaUno for follow-up visits to monitor the evolution of the recovery. All our patients, they have restored their vision in 100% with a less than a 5% complication rate, which is the standard of World Health Organization. To achieve effectiveness in this value chain, it's very important to focus on these critical success factors. The first one, volume. Like Arabin, SalaUno is a high volume model, so we need patients. We have to increase the number of new patients every day. And we also have to increase our conversion rate to achieve that all this volume of patients can be reflected on more surgeries. Also, operational efficiency. We want to monitor the cost of our services to make them affordable. So that's why having a good control of the cost of our services will be very important. And also standardization. To achieve effectiveness, efficiency, and quality, we want to have our standardized procedures. And like I said, all our team must be deeply internalized with the culture and values of SalaUno. These three critical success factors will help us to increase our impact metric of the number of eyes with sight restored, and we want to increase it for next year to 16,000 cases. Like I said, efficiency is very important, so let's take a look to the cost of our main service, cataract surgery. In this chart, you can see the fixed and variable costs of our surgery. Both have to be reduced, both have to be controlled, but the fixed costs represent a good opportunity to achieve economies of scale from a high volume model. So controlling and manipulating this cost is very important. I have told you many of the current characteristics of SalaUno, but now let's take a look into the future of SalaUno. We started working on August 2011, and for this year we want to add 2 vision centers so we can increase the volume of our operating rooms. For next year we want to have more vision centers, but we also want to build another surgical clinic. In this phase, standardization will be very important, so replication will be easy and efficient. And also, if we are going to create all these facilities, we need marketing strategies to motivate the flow of the patients to each one of these facilities. For the next years, we want to take the SalaUno model out from Mexico City and to replicate it on other major cities in Mexico. We want to create more surgery clinics, we want to create more vision centers, and on this stage, our conversion rate should be from 75%. But how we are going to do all this? Well, let's take a look on our financials. Like I said, we started working on August 2011, and in the last quarter, we have been profitable. And we are expecting that this profitability will maintain and will be increased during the next years. This will help us to be self-funded on our operations, so any external funding will be used for our expansion phase. As you can see, in 2012, we want to have a new surgical clinic, so we are looking for a loan for that. And also for 2013, we are looking for investors to help us with the expansion through Mexico. I have told you many things of SalaUno, but I haven't showed you the most valuable thing of SalaUno, and it's the team. The two founders of SalaUno, Carlos Orellana and Javier Ojuice, they both have experience on investment banking in the USA and in Europe, and they are very committed with the social mission of SalaUno. We also have a management team integrated by young and talented and motivated people, from which I feel very proud to represent here at the GSBI, and I also feel very proud to work with them every day. And we also have our medical team. They are all skilled and well-trained doctors, nurses, and optometrists that help us every day on our mission. We also have an advisory board that they help us with their experience and knowledge to define the strategies and plans of SalaUno. They all have graduate degrees from Harvard, Stanford, and Northwestern University. But we also have the support of eye care experts from around the world and in Mexico, like David Green, a social entrepreneur widely recognized around the world. We also have Mr. Tulsarash, member of the founding team of Arabind, and we also have the support of Dr. Barojas, who is director of the National Institute of Rehabilitation in Ophthalmology. What we are looking for is for a loan. We are looking for $500,000, and we will use it to create more vision centers and to open our surgical clinic. With this, we'll be able to diagnose more patients, to make more surgeries, and they all will be reflected on increasing the number of eyes with restored sight to 2,000 eyes per year. And also for 2013, we are looking for investors so they can support us on our expansion phase. I hope you have enjoyed this presentation. I'm very thankful with the GSBI for this wonderful once-in-a-lifetime experience, but also I would like to join us in SalaUno so we can all together eradicate avoidable blindness in Mexico. Thank you very much.